you are in your 20s and going to the doctor without a problem for a preventive health checkup is definitely not in your priority list right now. But believe me, even at your age, having regular checkups go a long way towards preventive health of your current and future health. Today, I, Dr. Sudeshna Ray, would talk about the tests that you need to do before the age of 30. Here's the list. 1. A check on the weight, no matter how much we hate it. It is really not a question of being in the ideal weight or attaining an ideal weight, but being within an optimal weight range for your height. Being beyond this range can be a risk factor for many future illnesses. 2. Blood pressure. Now it's a very simple check, a very simple measure which is inexpensive, quick and easily available. If the blood pressure is around 120/80, then once a year check is good enough. If, however, you have a blood pressure which is above 130/80, then you definitely need to see your physician. A steady, normal blood pressure is a very fair indication of a good health of your heart, kidneys and eyes. 3. Cholesterol profile. Now this is done through a blood test. Especially for those who have a strong family history of diabetes or high blood pressure or hypertension that we call it, or obesity or a heart disease. We even advise the cholesterol profile for adolescents who have a strong family history of diabetes and obesity, or if someone is obese or someone has persistent irregular periods. Blood sugar check. Again, especially if you have a family history of diabetes or you are suffering from persistent irregular periods or obesity or PCOS. 5. Pelvic examination and a pap smear test. Now, I know I'm entering into an uncomfortable zone and a lot of you might think about skipping this part. But if you skip this part, you're going to be the loser because this is very important. Very, very important. Now, a pap smear test is a test like an internal examination where we collect a little bit of fluid or water from the mouth of the womb and send it for a test under a microscope. It should be done at least 2 to 3 years after you initiate your sexual activity. Now, whether you like it or not, I am going to spend a few more minutes on this. Now, why are we talking about a pap smear? What does a pap smear detect? A pap smear detects conditions which can lead to cervical cancer. What is cervical cancer? Cervical cancer is the cancer of the mouth of the womb. And why is this so important? Because it is the number 1 cancer for women in India. And why am I spending so much time in talking about cervical cancer? Because it is almost a completely preventable cancer. A pap smear detects a condition which can lead to cervical cancer, as I told before. So if a precancerous condition is detected through a pap smear, that can be completely treated and hence and thus the cancer, cervical cancer, can be prevented. Now, pap smear should be done ideally along with an HPV testing, which is a human papilloma virus testing. Between 20s and 30s, it should be done at least once in 3 years. And if both HPV and pap smears are negative, then beyond the 30s, it can be done once in 5 years. Now, I know that this sounds a little uncomfortable test, and it is a little uncomfortable, and this is the reason why you as a young girl or a young woman do not come to us for this test. But believe me and remember that a few minutes of discomfort can go a long way in earning you the rewards of preventing yourself or protecting yourself from cancer and some other conditions also which can lead to infertility. 6th, breast checkup. Now this can be done as a self-examination or a clinical examination by your doctor. Now, for a self-examination of the breast, you should choose the first Sunday after you start your periods, monthly periods. That's the time when the breast tissues are not swollen up, and that's the time when you can detect any abnormality very easily. If you want to do an ultrasound, especially if you have a mobile lump or if you have some breast cysts which is detected from before, once a year ultrasound should be good enough. If you feel a lump while self-examination, please go to your doctor and get it checked. Now, a mammography is usually not recommended at this age, but if you have a very strong family history of cancer, for example, if you have an immediate family member with breast cancer or a first or second degree relative with breast cancer less than 40 years of age, then mammography should be started even around the 30 years of age. 7. Check on the immunizations. So this is a good time to update all your immunizations. At this age, the vaccines which are important are chickenpox, MMR, that is mumps, measles and rubella vaccine, and the HPV vaccine or the cervical cancer vaccine if you haven't taken them before the age of 20. Also, you should consider flu shots every year. And don't forget your dental and eye checkups. Now, during this time, you can actually utilize this time with your doctor to also discuss lifestyle factors such as diet, exercise, sleep, and your sexual health. Don't wait for symptoms. A lot of troubles can be avoided if you do preventive health checkups. So be proactive, take charge of your health, and take care. If you have any further queries, please don't hesitate to write to me at drsudeshnacares@gmail.com. Thank you.
Subscribe to our YouTube channel and hit the bell icon so that you don't miss any videos by us.